This depends on your family history as well, that what is the menopause age for you. So it is not fixed but in general, like 50 to 55 is considered to be postmenopausal age in Indian scenario, right? So what happens if you don't get menses at least for 1 year at this age, 50 to 55? That means it is, you can consider, yeah, menopause has been achieved. If for more than 1 year you're not having any bleeding, and now all of a sudden you see, yeah, today morning I saw a spotting or there was a bleeding proper, so this is not good. So this is called postmenopausal bleeding. And why it is abnormal? Because once you achieved your menopause, and if now you are having postmenopausal bleeding, there must be some reason behind it. It is not normal. Suppose this is uterus, right? Uterus is a closed space. So uterus, and below uterus there is cervix. There may be cervical polyps. Polyps you can imagine like a balloon sort, which is knotted one. This can be small, this can be big. So sometimes the polyp starts bleeding, or there may be inside the uterus, there may be something, overgrowth of the endometrium, or you can say endometrial malignancy, cancer. So these things are not making you feel afraid, but because postmenopausal bleeding is a serious issue and it must not be neglected, must not be. So this is my main message. Whenever any female who has attained menopause and has seen bleeding or spotting, even spotting, then also she must take it seriously, and please consult your gynecologist immediately. She will examine you per abdomen, per speculum, per vaginum, and apart from that, she will get the investigation done, like pap smear, or that's higher version is called LPC, and moreover there is sonography. So many things are there, and clinical eyes of the doctor, they see that this is the problem with this patient. And in those cases, even the investigations are to be done timely, without ignorance, because many patients don't understand the gravity. But this is really a thing which should be worked up properly and timely. Don't ignore it, please, and get the endometrial biopsy or get the cervical biopsy. It can be cervical malignancy, it can be simple cervical polyp, it can be endometrial, simple atypical endometrial hyperplasia, or it can be a proper malignancy. So please, or it can be an ovarian tumor. So please get the proper investigations done. They are the minor things. In the OT, we under short sedation, we can take the biopsies and we can be 100% sure, because biopsy is the gold standard. So we can be 100% sure that this is the problem and we should tackle this with this treatment. Postmenopausal bleeding symptoms will show as the bleeding. And in that case, the patient sometimes will say, only spotting I have seen, or dark brown discharge I have seen, because there will be mixing of the blood with the infectious material which is inside the uterus, or it can be cervical cancer. There may be cauliflower growth like thing, or dirty smell, foul smelling discharge. They are indicator that there is something wrong with the cervix or the endometrium. Sometimes the patient will not see from outside, like there won't be spotting or bleeding. Sometimes the patient will say, I have lower abdominal pain, or she can complain of the bladder or the rectal bowel symptoms. Why is it so? Because cervix and uterus, they are in between. Uterus is here, cervix is here, and anterior to the uterus there is bladder, that is our urinary bladder, and behind the uterus all the abdominal intestines are there. Okay, so the patient, if the malignancy is of a higher stage, then what will happen? She will say that, ma'am, I have increased frequency of menstruation. or ma'am, I'm not able to pass the motion properly, because they will be having constipation, or they will be having increased frequency of motion. So these things will indicate, will click a doctor, yeah, there may be involvement of the bowel or bladder along with the cervix or the endometrium. She can complain that, ma'am, I am having lower abdominal pain, and I am having a distension of the abdomen, or I can feel mass in the abdomen. I'm feeling that my abdomen size is increasing. I'm feeling something hard in my abdomen. So these things, or if it is advanced malignancy, it was undetected, she may complain of respiratory issues that, ma'am, I'm having sometimes blood in my sputum when I cough hard. Then there are some spots of blood I have seen, or she can complain you that I have difficulty in breathing, or sometimes she may say I have some eye issues, or I'm having severe headache, I have some particular joint issue. So what, like, you should not ignore any of these things, because the patient in advanced disease can have spread of the malignancy in lungs or brain or eyes or any joint. That's why she's complaining of these things. So please don't ignore. The test of the postmenopausal bleeding, that starts with the normal routine, that blood group, the CBC, then urine routine, then other investigation which include HIV, HPSAG, BPRI, sugar test, and urine test, the ECG, chest X-ray. They are the basic investigations. Apart from that, the diagnostic investigation, which is particularly for the cervix, that is the LBC. That is a liquid-based cytology. And this is a higher version of the pap smear. Pap smear everybody knows, but that was a bit conventional method. Better to that, we have the LBC nowadays. The only thing is that is the cost matters, and but the results are much better than the pap smear. So we can explain to the patient, and many times they get it. And after that, sonography, because sonography of the whole abdomen, because we have to see liver, kidneys, pancreas, gallbladder, everything is normal, not only about the cervix and the uterus. Okay, then if we suspect, we should go for the chest X-ray and ECG, because these are the basic investigations. And if you see in sonography, if you feel that the uterus size or the endometrium or cervix, there is anything abnormal like fibroids or endometrial hyperplasia or cervical polyp or cervical malignancy, whatever you, or ovarian tumors, whatever you are seeing, and something clicks to you, then you should go for the higher investigations. And MRI, CT, they add on to your clinical examination. So in nutshell, we do clinical examination, then we go for the blood reports. Side by side, we do the sonography, CT and MRI, accordingly what we are suspecting. And when we conclude that this is the problem, then we should go for the biopsy. Biopsy is the gold standard for making the diagnosis that this is which type of the cancer, or it is a benign problem or malignant problem. That starts from, if it is a benign lesion, then we have many modalities like cryotherapy, then we have simple removal of the polyp, then we have endometrial diagnostic evacuation and curettage, then we are sending it for histopathology, then wherever, like if you are suspecting in ovaries, then we have blood markers like CA125, and then we can go for the biopsy. And if we diagnose once, this is the malignancy of this particular part, then of course we'll do surgery for that particular malignancy. If this is in that, staging is important. In that case, we do the staging of that particular, like CA cervix, that has a staging, CA endometrium, that has particular staging grades, then ovarian tumors, so the vaginal, vulva, so they I have focused more on the cervix, endometrium, ovaries. But vagina itself, vagina and vulva, they also have a higher rate of malignancy. So, but in those cases, the good thing is that we can see them easily. So, most of the patients which come at the late stage, they are of the cervix, endometrium, and the ovaries. And the vagina and vulva, because that is seen with the naked eye, so usually they come early. So, this is a good thing. So the treatment depends on that particular site malignancy, and then we treat accordingly: surgical, then chemotherapy, and radiotherapy. So these three modalities have to be combined, and it's a teamwork. And we take the oncosurgeon, we take the radiotherapist, and we take the oncophysician also for the chemotherapy, and then we deal with those cases.